The primary treatment for cataracts is surgical intervention. Cataract surgery is a safe and effective procedure that involves removing the cloudy lens and replacing it with an artificial intraocular lens, IOL, to restore clear vision. Here's an overview of the treatment process for cataracts. Preoperative assessment. Before undergoing cataract surgery, you will have a thorough evaluation by an ophthalmologist or an eye surgeon. The assessment typically includes a comprehensive eye examination, which may involve tests such as visual acuity measurement, refraction to determine your prescription, slit lamp examination to examine the structures of your eye, and measurement of intraocular pressure. Extent of cataract. The ophthalmologist will evaluate the severity and impact of the cataract on your vision. They will determine whether the cataract is significantly affecting your daily activities and visual function. Intraocular lens, IOL, selection. Based on the measurements taken during the assessment, the ophthalmologist will calculate the power of the IOL that will be implanted during surgery. The IOL selection aims to provide you with the best possible vision after cataract removal. Surgery. Cataract surgery is typically performed on an outpatient basis and usually takes less than an hour to complete. You do not need to stay overnight in the hospital. It is generally done under local anesthesia, which means you will be awake during the procedure but your eye will be numbed to prevent any discomfort. The surgical procedure typically involves the following steps. Anesthesia. Cataract surgery is commonly performed under local anesthesia, which involves numbing the eye using eye drops or an injection near the eye. This ensures that you won't feel any pain during the procedure. In some cases, general anesthesia may be used. Incision. A small incision is made in the cornea, the clear front surface of the eye. The incision is usually less than 3 mm in size. Phacoemulsification. Phacoemulsification is the most common technique used in cataract surgery. It involves the use of an ultrasonic probe that emits sound waves to break up the cloudy lens into tiny fragments. The fragments are then suctioned out through the probe. Intraocular lens, IOL, implantation. After removing the cataract, an artificial intraocular lens, IOL, is implanted in the eye to replace the natural lens. The IOL is typically folded or rolled and inserted through the same small incision. Once inside the eye, it unfolds or unrolls to its proper position. Stitchless closure. In many cases, the incision made during surgery is self-sealing and does not require stitches. This promotes faster healing and reduces the risk of complications. Recovery and post-operative care. After cataract surgery, you will be moved to a recovery area where the medical staff will monitor your vital signs and ensure you are stable before you are discharged. You will receive instructions for post-operative care, which may include eye drops. You will be prescribed a regimen of eye drops to prevent infection, reduce inflammation, and promote healing. It's important to use the drops exactly as instructed by your doctor. Shield or protective eyewear. You may need to wear a protective shield or eyewear to prevent accidental contact with the operated eye during the initial healing period. Rest and recovery. It's important to take it easy and avoid strenuous activities for a few days following surgery to allow your eye to heal properly. Recovery and post-operative care. After cataract surgery, you will be monitored for a short period in the recovery area before being allowed to go home. You will receive specific instructions on post-operative care, including using prescribed eye drops to prevent infection and promote healing. Healing and vision improvement. The initial recovery period is relatively quick, and most people experience improved vision within a few days following surgery. However, it may take a few weeks for your vision to stabilize and for your eye to fully heal. Follow-up visits. Your surgeon will schedule follow-up visits to monitor your progress, assess the healing process, and evaluate the effectiveness of the IOL. These visits are essential for ensuring that your vision is improving as expected and addressing any concerns or complications that may arise. Your surgeon will schedule several follow-up visits to monitor your progress and ensure proper healing. During these visits, they will assess your vision, check for any complications, and make any necessary adjustments to your post-operative care regimen. Vision improvement. Most individuals experience noticeable vision improvement within a few days after surgery. However, it may take a few weeks for your vision to stabilize and for your eye to fully heal. Your vision may continue to improve gradually over time. Glasses or contact lenses. While cataract surgery aims to reduce your cataract surgery has a high success rate, and the majority of individuals experience significant improvements in their vision and quality of life after the procedure. However, as with any surgical procedure, there are potential risks and complications, such as infection, bleeding, inflammation, or changes in eye pressure. Your surgeon will discuss these risks with you and guide how to minimize them. It's important to note that cataracts can develop in both eyes, but surgery is usually performed one eye at a time, with a gap of a few weeks or months between surgeries, depending on the individual's overall health and the surgeon's recommendation. If you suspect you have cataracts or are experiencing vision problems, it's advisable to consult an eye care professional for an accurate diagnosis and to discuss the most appropriate treatment options for your specific situation.